Good evening, and thank you so much for joining me on today's weekend edition. My name is Nora Osende, where we delve into critical conversations shaping the future of the healthcare system in Uganda. Now, recently, the Uganda Catholic Medical Bureau hosted its 2025 Annual Health Assembly, bringing together health practitioners, policymakers, and key stakeholders. That's to discuss ways to enhance the health care delivery within the Catholic Health Network. Now, this year's theme is leveraging technology and innovation to enhance and sustainably deliver quality and patient-centered healthcare. Now, highlights on the growing need for innovation in the medical practice with strong emphasis on patient-centered care. To give us insights into the key discussions at the Assembly, well, today we are honored to have Dr. Ronald Kasiaba, the Assistant Executive Secretary of Uganda Catholic Medical Bureau. He will be sharing his thoughts on the Uganda Catholic Medical Bureau, the impact of the technology on the healthcare, and the future of patient-centered service delivery in Catholic health institutions. Thank you so much for joining us, Doctor.
Thank you, Nora. Good evening, viewers.
It's really nice to have you, Doctor. And like I've been just explaining in my intro, Uganda Catholic Medical Bureau actually had its annual General Assembly, and we could just dive into explain to us briefly the purpose of this year's Uganda Catholic Medical Bureau Annual Health Assembly. What was it meant for?
So it is called the Catholic Health Network Annual Health Assembly. It's an activity for the Health Commission of the Uganda Episcopal Conference. And the Catholic Medical Bureau, as the technical body that is working on behalf of the Health Commission, does the preparations and the actual work. But the Annual Health Assembly for the Catholic Health Network is a forum that brings together senior leadership, the boards of governors and managers of the 33 hospitals, the 17 health center force. We invite stakeholders in the health sector in this country, Ministry of Health, Ministry of Local Government, Ministry of Finance, and all the representatives from the local governments where the Catholic health facilities are located. We invite the leadership of the religious institutes that provide health personnel in the Catholic health facilities. And then we also invite key stakeholders, especially the partners that are supporting the Catholic health facilities across the country. So the purpose of the Annual Health Assembly is to bring together all these partners and stakeholders and the leadership and managers of the facilities together. And it is mainly for three reasons. The first is to enhance collegiality, just to bring ourselves together as a Catholic Church health network. And this we do through Mass. We begin with the Eucharistic prayer. And the second reason is to announce the theme for the year. And the third is to give an accountability of the performance of the Catholic Health Network in Uganda and what our contribution has been to the national health outputs. So those are the three main reasons. It's a two-day event, and those are the three main reasons that we come together to show our solidarity, because the Catholic Health Network or the Uganda Catholic Medical Bureau accredited health facilities, wherever they are in this country, are part of the Universal Church, and whatever they are doing is part of the healing ministry of Jesus Christ. So we are moving on to one theme, and we come together to reaffirm that, to reaffirm our solidarity, to reaffirm our collegiality, and also to tell the leadership and our stakeholders what support they have given us and how it has contributed to the national health outputs.
Very important there. Yeah. I think if there is any important reason to come together, those three that you've mentioned are actually very, very important.
Sure.
I want us to dig a little bit into the theme of this year, which is leveraging technology and innovation to enhance sustainable delivery of quality patient-centered healthcare. Why was this theme chosen exactly? And what impact do you hope for this theme to have?
Sure. So the theme is leveraging technology. We are mindful of the changing landscape of service delivery, healthcare service delivery. And in the theme, we also included innovation. So technology and innovation, and then the other aspect is looking at the patient rather than the disease. Okay, we are saying, how do we leverage technology to deal with the person, to deal with the patient, to deal with the client, rather than leveraging technology to deal with the disease. And we are looking at the theme and saying, can we put this together to continue enhancing the quality of care that we are known for? And I have to add that if you ask me and say, how different are you from the other health service providers, I'll tell you, we offer quality. And we always aspire to maintain quality. So the theme for this year was, how do we leverage technology and the innovation therein to look at the person and to provide quality care. That's the basic thing that we are looking. And during the annual health assembly, we invite a keynote speaker. This year we had one, Mike, who comes and tries to put all that together and bring out the aspects of the theme to the network leadership. One of the things that we intend or we want to achieve is to rally, to bring the entire network around that theme. And for this year, we think it was rather timely, because as you probably will recall, early this year, when the new United States president was sworn in, he issued a flurry of executive orders, and some of these have required a rethink in the way care is provided, because U.S. government funding has been so significant in one, HIV care, but also in other aspects of the health sector. So because this was temporarily withdrawn, so we think, we are saying, how do we leverage technology to integrate the services while we continue offering care to the patient? The Catholic Church, the Catholic Health Network will not abandon the person. It will not stop giving services to especially HIV clients. But we are saying, how do we do it in the face of limited funding, in the face of no funding? And the fallback to is technology. And that's why we are saying now we need to leverage this technology to integrate the services that we are providing at the health facility. So one of the benefits, of course, is that it will seamlessly transition into the integration by using technology, because then we can say, instead of having to write a piece of paper and give you an appointment, then I can use technology to keep the appointment for you and get back to you and say, hi, you're supposed to return for your medication. But also for the data systems, to reduce on the paperwork by using basic digital tools. So some of the benefits we think have come in timely because of the executive orders, but we had still decided on the theme because we are mindful of the importance of technology in service delivery and how it can improve care, how it can help, for example, in the scheduling, in triaging, and also appointments. But we can also use technology to send you messages, for example, and remind you that please remember to take your pills at 10, or have you checked your blood sugar at 11. So these are all things that the technology is bringing to us. And what we have done as the Catholic Medical Bureau is to say, how do we leverage this to deliver the care?
That's very nice. I find it very interesting how leveraging technology to actually make the patient's experience a little smoother and better in so many ways. I'm also looking at it, it also makes the work of the medical personnel a little bit easier and better in that sense. However, when it comes to technology and the use of technology in different aspects of our life, let alone the healthcare, there is also a cost really that comes to it. And we have seen that cost also in the healthcare, really. Just kind of tell us how is the Bureau helping to strike a balance with making sure that there's use of technology, you're leveraging technology, but at the same time striking a balance between the cost of the health system or the healthcare that people are receiving?
Sure, you know, healthcare is not cheap. So and it can never be free. What we have been experiencing, someone else was paying the buck. But with the digital tools, with the technology that is coming on quite fast and thick, we are aware that the initial investment will be high. But moving forward, the costs will come down. So we are mindful of the cost implications, but we know that with the technology, the initial investments could go up, and then moving forward, they can be plateaued. The Catholic Health Network in Uganda derives its revenue from 4 main sources. And the largest is the user fees, or what they call the patient fees, where you pay for a service. Or sometimes you pay and get services for just one single payment. That's the major source. But we are aware that also government of Uganda is supporting the network, supporting around 84% of the Catholic Health Network facilities with what we call the primary health care grant, the non-wage, part of which goes to the JMS for medicines. And then the third one is what we've been referring to as the development funding, or money that has been coming from the development partners. And the significant contributor here was the United States. So when you talk about the cost, yes, the initial cost will be high, but it will plateau down. And we probably believe, as Uganda Catholic Medical Bureau and many other stakeholders, that it's high time we started making this appreciation that healthcare is not free, it's not cheap, but it can be made affordable. You can get affordable quality health care, especially if you come to the Catholic health facilities, but it's no free.
Right, no free.
Yeah.
It can be affordable.
Yes.
And it is good. That's one thing for sure. When we talk about the Uganda Catholic Medical Bureau, you are the Assistant Executive Secretary, really. Give us a glimpse of the role. What role does the Bureau play in advancing healthcare services within the Catholic Health Network?
Sure. Now, the Catholic Medical Bureau is the national office for the Uganda Episcopal Conference that specifically oversees and is responsible for coordinating Catholic health facilities in Uganda. And we do a lot more, including technical support, technical advice, but also monitoring quality of care in the health facilities that belong to the Catholic Church. At the moment, the Uganda Catholic Medical Bureau is coordinating 299 health facilities in Uganda with 33 hospitals and 17 health center 4s. The majority are health center 3s, around 197, and we have a smaller number of health center 2s. But these are facilities spread across the whole country, and in fact, out of 147 districts, there are only 22 districts that do not have a Catholic health facility in there. So our role as UCMB is to provide support for both governance and management, to set the norms which are consistent with the Ministry of Health norms of service delivery. But of course we have an eye for the Catholic doctrine. So we will get what the Ministry of Health will say, this is how we would love healthcare to be delivered. But then we would look at it with an additional lens, of course, in consultation with other colleagues at the Secretariat, who will say this may be inconsistent or is inconsistent, then say, no, this we will put aside, but we will follow this so that we can contribute to the national health outputs of this country.
Very nice.
Yeah.
Well, I must say this, but it's not because, it's not out of bias, really. Normally when you hear Catholic health facilities, the first thing that comes into your head is quality. That's one thing for sure. And that is one thing, a standard that has been put out there. But one thing I do know is that you have had also achievements. You could kindly highlight those achievements. But I believe where there is achievements, there are also some bit of challenges. You could throw in some bit of challenges as you actually highlight your achievements. Sure.
So, like I said, the major responsibility of the UCMB is to do the coordination of the Catholic health facilities or the network across the country. And our key achievement, I would say, is the consistent provision of quality care as we contribute to the service delivery of the country. We track our contribution proportion to the government to the Ministry of Health outputs. And we consider this to be an achievement because we are doing God's work, but we are also working alongside and facilitating what the government of Uganda through the Ministry of Health is doing. Now, so that to me is one of the major things that we keep doing. But we pride ourselves in the quality of health care, that we have a set of proxy indicators that we track every year to see whether the quality of care in facility X is being maintained. So, for example, we track patient satisfaction surveys. So we've been doing this for the last 15 years plus. And every year we have to get the data from the facilities and say, how are you performing? We track drug prescription surveys results for each and every facility. And this is a quality indicator. So we want to know, are you giving the right drugs? Are you giving a lot of antibiotics at outpatient? Are you giving injections that are necessary at outpatient? So we track this. This is the quality that we give. And we want to assure our partners that this is our contribution to the country. The major challenge is really financing. We believe that we could do a lot more, but the financing is a key aspect that impairs a lot more that we would be doing. When you look at the costing structure of most of the health facilities across the country, the cost of treating malaria is far lower than the charge that we ask you. And averagely, our facilities, especially across outside Buganda region, will be charging something like, you find it is 60% of the entire cost, between 40 to 60%. You know, some facilities in far north and the northeast, the cost is 100, they charge about 30. So 70 is paid by someone else, including government of Uganda, including partners, philanthropists, but then there is another small percentage that is covered by the facility providers, because even the amount of money that we pay healthcare workers is far less than what government of Uganda pays the equivalent cadre. So we think that the costing structure is affordable, really. So if you went to a facility and they charged you 1 million, just know that the cost would have been 3 million, but this is a Catholic health facility and we are intent on it being accessible and affordable. Yeah.
Nice. Let me go a little bit back to the assembly that just concluded. We had the honor of listening to the Right Reverend Bishop Robert Muhira, that's the Bishop of Fort Portal, who also emphasized the need for a patient-centered approach rather than disease-centered, something that you had earlier on actually hinted. Just tell us how Uganda Catholic Medical Bureau is encouraging health facilities to adopt this approach.
So, one of the things that we did in a meeting like the annual health assembly, we highlight it. But most importantly is one of the key aspects of Catholic health care services is looking at a person as a whole. Not so you take the entire person, physically, emotionally. So you look at the a holistic person, a whole person, and what we are encouraging and what we would love to have to see in the facilities is to look at the human being who comes. Look at the human being and deal with the disease that is in the human being, but they have to be a human being first. So we are encouraging and we will be tracking this. And that's why for us it's been easier that if you say integrate HIV services to all other services within the health facility, it is something that is far easier for us, because if I came into your clinic, you look at me first, and then you have to find out I have maybe HIV, I have diabetes, I have hypertension, and I also have malaria. So I have 4 conditions in my body, but I am one person. So other than you saying this is an HIV person, then you say this is a person, but with a couple of conditions. So we will keep talking about it. We have various fora where we meet the leadership and the managers of the hospitals and health facilities, and we have communication channels through which we have to keep fostering this to make sure that the patient remains the patient rather than the disease that you would want to see in the patient.
Interesting.
Yeah.
So that has a lot to do with change of attitude and so much more.
Sure, yes. So yeah, I mean it goes without saying there will be quite a lot of work on the change of attitude, but it's a core value for the Catholic Church to deal with the person rather than with the disease. So we encourage it, but we also have to keep reminding them of the values of the church.
The person first and then the disease.
Then the disease.
That's a nice way of looking at it, really. Tell us about any specific advancements or technology or platforms or digital platforms that are being encouraged by Uganda Catholic Medical Bureau, or that you really feel like our health centers, we are pushing for this kind of technology in our health centers for better service delivery. Are there any specifics?
Sure. Well, the one that we've been talking about quite a lot is the digitalization of data, to move away from paper. We are aware that the Ministry of Health is moving towards this direction of going paperless for medical records. And so the key thing is we are looking at digitalization of data and automating the system. So when we go automation, then some of these cards that you walk around that keep saying I am a diabetic and my appointment is on the 7th will be off. So if you have a phone, then it is just automatic that the data will be put in and say Ronald is due for review on the 7th, and on review these are the things that will be done, and this you'll get a reminder on your phone and you simply come over. The other way, especially when we go digital full-blown, is for these messages to keep coming to your phone and reminding you. But most importantly, we have been looking at within the health facility that you move from one room to another. You don't need to go piling papers for every other room that you go to. It's already working in a couple of hospitals in Zambia, Rubaga, and most of the major big hospitals in the Catholic Health Network. Once you see a clinician in room A, by the time you reach room C, the person in room C already knows what they have already done. So they don't have to ask you for a paper, and they don't have to begin afresh to ask you questions.
Okay.
Yeah.
I guess that's kind of, you went into kind of what I wanted to ask earlier on, which is really okay. And but you could still expound a little more of some of the success stories that you've had in the Catholic health facilities where the technology has actually made quite improvements. You have talked about, you know, some hospitals and how it has lessened the burden of paperwork. You can also hint a little more on something else, if you don't mind.
Sure, but I mean, basically that's what we are pushing for, to make sure that all the data is digitalized. And like I've said, most of the Catholic Health Network is 33 hospitals. Almost all these hospitals have digital platforms, and we are encouraging them to move towards that level where you may not have to walk around with a book or with a piece of paper. You only have a code which will help you to access your data. And with that, of course, we are complying with the data protection laws of the country to make sure that there are no breaches or data doesn't find itself on some other forum where it might be misused.
Right, yeah. Right. And I don't think we've had that with any of the Catholic facilities, no.
Not as yet. I've not heard of any. We are still lucky, probably, but we are also putting in place mechanisms to ensure that this is done well. And my condition, what you found in me, can only be accessed by a clinician who comes to the health facility.
With this kind of work and with the quality of work that you do, really there has to be a bit of collaboration with different entities. Tell me about how your collaboration is going with the Ministry of Health in making sure that the health services in the Catholic network is actually tick.
So our major partner is Government of Uganda, and the Government of Uganda has supported the Catholic Health Network at multiple tiers. The Ministry of Health, through the Health Service Commission, seconds some doctors to the network, but also the local governments do secondments. I also talked about the funding that is given to some of our facilities, about 84% of our facilities, the PHC funding. So they are a major partner. Of course, the other partners are and have been the development partners, especially the United States government and other governments in Europe. They are supporting the Catholic Health Network through the various entities, sometimes directly to the health facilities, but also through the UCMB. So these are partners that help us do our work and improve our service delivery. But the Government of Uganda is key, and we believe that the partnership is about comparative advantages rather than competitive advantages of the two, of the Catholic Health Network and Government of Uganda network. So we say, what do we do comparably better that we can offer to continue the outputs of the Government of Uganda?
That's a nice way to do it, and it's a nice way to really look at it. Well, our time is fast spent, but I can't leave without asking two more questions. Let's look to the future, really, looking ahead. Give us some of the key priorities that Uganda Catholic Medical Bureau is looking at in the coming years.
Yeah, sure. No, so the major one is full digitalization of all our services. No more paper. We hope we will get there. We look to a point where paper will be minimized as much as possible. That's one of the key things we are looking for the future, to maintain the quality of care and the contribution that we give to the Government of Uganda, but also to continue the healing ministry of Christ.
Nice. And then finally, but not least, really tell us how we stakeholders can be in support of the mission of Uganda Catholic Medical Bureau in providing quality health care.
So the media, it is through the advocacy, the lobbying, and bringing out aspects that need to be attended to, because just like I've mentioned all these good things that maybe are happening in the network, there are flaws. There will be occasional drawbacks, which I would say, look, Ronald, we want to bring this to your attention, and how do you respond to it? I would be more comfortable giving you the response rather than saying, now, She spread all the messages across the platforms without asking me, and now here we are fighting back and doing firefighting. So you can do quite a lot of work in, say, we can lobby, we can advocate, we can give feedback, because you say we give feedback to the providers, the Catholic facility. You can say, let me reach out to UCMB and give them feedback, but you can also facilitate us to do the advocacy for more funding or more support from the stakeholders.
And we are definitely going to be partners with you in that.
Thank you very much.
It has been nice having you. A word to someone else there in regards to Uganda Catholic Medical Bureau before you close off? A word that you can give to someone else there?
Well, so thank you very much for hosting us. I would like to thank the Uganda Catholic Television for giving me and the Uganda Catholic Medical Bureau a platform to share a brief of what the Catholic Medical Bureau does, but also to reach out to the people who are watching that our aspiration is to continue providing quality care, and we would love to receive this feedback. It helps. It helps us to do better. Thank you.
Oh, thank you.
Yeah.
Thank you so much, Dr. Ronald Kasiab.
Thank
It has
you.
been nice hosting you, and we look forward to so many much more.
Thank you very much.
All right. And it has been nice having you on the weekend edition. My name is Nora Sende. I'll see you next Sunday. For now, God bless and good night.